Hi, my name is Michelle, and today we're going to be doing a physical assessment on Tom as my patient. Tom, could you tell me your full name and date of birth?
Thomas James Dutzar, August 24th, 1998.
Okay, so I could see by talking to my patient that he's alert and he's oriented, and by looking at his outfit, he is appropriate for weather. I'm looking at his skin, and I could see that his skin has no lesions, no redness, and no scarring, and he's normal for ethnicity. I could also see that he's generally in a good mood. So next we're gonna go on to the abdomen assessment. So I'm gonna have him lay down and I'm going to do the assessment of him. The first thing I'm going to do is have him lift up his shirt and I'm going to inspect his skin. I could see his skin has no lesions, there's no redness. I could also see that his abdomen is not distended, so this is a normal finding. Next, I'm going to go to the end of the bed and I'm going to look at his abdomen, and I see that there's no peristalsis, so that is also a normal finding. I'm going to take my stethoscope and I'm going to auscultate bowel sounds. Normally, you would auscultate the bowel sounds for 2 to 5 minutes, but for the sake of time, we're gonna do it for less, and I'm going to listen in all 4 quadrants. Usually there's also 30 to 35 sounds per minute. That would be normal, so I'm gonna start in the right lower quadrant. So bowel sounds are present in all 4 quadrants, so that is a normal finding. They're normal active. Now I'm going to also auscultate vascular sounds, so I'm going to start with the aorta. Next, I'm going to listen to the bilateral renal. And finally, I'm going to listen to the bilateral iliac. All are present, there's no bruits and there's no venous hum, so this is a normal finding. Next, I'm going to percuss all quadrants, and it's normal to have tympany throughout the entire abdomen. So I'm going to start at the lower. Okay, next I'm going to percuss the liver, and I'm going to start at the midclavicular line under the umbilicus and percuss until I hear dullness. Then I'm going to go to the midclavicular line at the area of long resonance, and I'm going to percuss until I hear dullness again. Okay, the normal liver span is 5 to 12 centimeters midclavicular line and 4 to 8 centimeters midsternal line. Next, I'm going to percuss the spleen. This is on the left side, and I'm going to start from about the last intercostal space and move down. Okay, a normal spleen is tympanic or resonant. An enlargement could mean it would be dull. Next, I'm going to do light palpation on the abdomen with one hand, and I'm going to notice if my patient has any pain or tenderness. Any pain?
No pain.
Any tenderness?
Nope.
Feels fine?
Feels good.
Okay, awesome. Next, I'm going to do deeper palpation. So this is like with 2 fingers and a little more pressure. I'm trying to see if there's any reaction, any pain, or any tenderness. So, anything?
Nope.
Okay, so my patient feels no pain. This is a normal finding. Next, I'm gonna palpate the aorta. So this is above the umbilicus. I'm gonna put my hands on either side of the aorta. So if it was enlarged, that could mean there's a possibility of aneurysm, and that would be 3 centimeters or greater. Next, I'm going to palpate the liver border, and I'm going to have my patient take a deep breath while I do this. That will bring the liver down, and I'll palpate under the rib cage. So I want you to take a deep breath. Okay, let it out. Good. Now I'm going to palpate the kidneys, so I'm going to lift up and palpate on both the right and the left side. So normally, the left kidney is not palpable and the right kidney feels firm, smooth, and palpable. Those are normal findings. Now I'm going to palpate the spleen. So also again, I'm going to have my patient take a deep breath when I say to. And this is on the left side of the ribs where I would palpate the spleen if it was enlarged. So Go ahead and take a deep breath. Good. He's not enlarged, so I can't palpate it. Next, I'm gonna have my patient sit up. Okay, now next I'm gonna do the assessment of the upper extremities. So I'm going to first inspect the clavicle on both sides bilaterally. Next, I'm going to inspect the scapula bilaterally and the shoulders as well bilaterally. So I'm making sure as I'm doing this that they're in line, that there's no displacement and there's no distortion in either the clavicle, the scapula, or the shoulders. There is none, and this is a normal finding. Next, I'm gonna palpate the joints. So I'm gonna start with the sternoclavicular joint. Over here. Next, I'm gonna do the AC joint on the shoulder. Now I'm gonna do the elbow joints. Good. And next, I'm gonna do the wrist joints. Okay, so there's no abnormalities there. Now I'm going to test his range of motion and strength. So first I'm gonna start off with the neck, and I want you to bend your neck to the right side, to the left, go up, down. Next, I want you to put your ear to your shoulder, now to the other shoulder. And finally, I'm going to have you go against the resistance of my hand, turn towards my hand, and turn towards my hand again. Good, so he was able to do that without any difficulties, so he has full range of motion. Now I'm going to test the range of motion in his shoulders, so I'm gonna have you put your hands above your head, and I want you to move your arms backwards. Now move them forward. Good. Now I want you to put them in a T position. So I want you to cross your arms in front of each other, and the other way. Very good, he's able to do that completely. Now I want you to scratch the back of your neck with one hand. Do the other arm. Good, and now I want you to take your right hand and try and touch your opposite scapula. Now do that with your left. So he's able to do that without any problem. He has normal, full range of motion. There's no signs of pain either?
Nope.
All right, so this is a normal finding. Finally, I'm going to test the range of motion in his elbow. So I want you to bend your arms up to your shoulder and down. Good. And next, I want you to straighten your arms and put your palms up and now down. He was able to do that without any difficulty, so this is a normal finding as well. So next, I'm gonna be testing the reflexes. So I'm gonna start with the biceps reflex. So this side, you can see a reaction, and that's 2+, and that's normal. We're going to go over to the other side. Reaction again, 2+, and that's normal. Next, I'm going to work on the brachioradialis. Good, that's 2+. That's 2+, and that's normal as well. Finally, I'm going to do the triceps. Here. Good. And go over to the other side. Good. That's also 2+ and strong, and that's a normal finding. Next, I'm going to palpate the pulses. So I'm going to palpate the radial pulses. You do this bilaterally. They're 2+ and strong. Next, I'm going to do the brachioradialis pulses. Once again, you do this bilaterally. They're 2+ and strong as well. Next, I'm going to inspect the hands. So I'm looking for nodules, lesions, redness, or pain or tenderness. There is none, so this is a normal finding. I'm also going to palpate the snuff box on both hands. It's on the thumb over here. Good, and if there was tenderness around the thumb area, that could mean that there's a possible fracture. Next, I'm also going to test the range of motion in the hands. So I want you to put your hands out. I want you to turn them up to the ceiling. Now I want you to turn them down, inwards and outwards. Move your fingers out and in. Good, and now twist again your wrists. I want you to twist your wrists inwards, and I want you to twist your wrists outwards. So he has full range of motion, and there's no restriction in his wrists or hands, and this is a normal finding. So next, I'm gonna have my patient lie down on his stomach, and I'm going to be assessing his hips. So first, I'm going to palpate the isis. And I'm gonna place it on the hip bones. First is the isis. Next is the iliac crest, and that's a little bit further down. Next, I'm going to do the iliac ischial tuberosity, which is right above the buttocks. Next, I'm going to do the PSIS or the ISIS. These are the dimples right above the hip bones. Is there any tenderness on palpation, Tom?
Nope.
There's no swelling and there's no redness, so those are normal findings. Next, I'm going to do range of motion. So I'm going to have him lift his legs up one at a time. Lift that leg up. And now the other one. Good, he's able to do that. So that shows extension of the hips. Now I want you to turn back over. And we're gonna show flexion of the hips, basically by lifting your legs straight in the air one at a time. And the other one. Good, now you're going to do abduction. So bring your leg away from your body one at a time. Good. And the other one. Good. And now we're gonna show adduction. So I want you to cross your leg over one another. Good, and the other one. Good. Next, I'm going to have him bend his knees, or bend one knee at a time, and I'm going to internally rotate them and externally rotate the hip. So in, good, and out. Once again, inward, internal rotation, and external rotation. And down. And now my patient can sit up again. So next I'm going to assess the lower extremities. So I'm going to start by inspecting and palpating the meniscus and the knees. So both knees, both the meniscus on either side, the patellar as well. There's no swelling, there's no pain, there's no redness, right Tom? No
Nope.
pain? Okay, good. Now I'm going to assess his ankles and his shin. No pain, no swelling, no tenderness. No pain, no swelling, no tenderness. Good. Now I'm going to have him stick out his leg and try to bring it back in. Bring it back in. Now the other leg, bring it back in. Good. Now I'm going to test his reflex here. So I'm just going to hold up and go right under the patellar. That's 2+. Good. That's 2+. Good. So now I'm going to move on to the foot and the ankle. So I'm going to do this one first. No swelling, no tenderness. I'm looking at the metatarsals as well. No swelling, no redness, no tenderness in the foot, ankle area, nothing. So those are normal findings. It's the same thing with his metatarsals, his ankle, all of his foot, they look normal. So now I'm gonna test the range of motion in his feet. So I want you to put your feet on over my lap. Now point them upwards, now downwards, now out, now in. Good. So now he's able to do that without any difficulty. He's able to roll his ankles inward and outward. Those are all normal findings. So I'm also going to palpate the pulses in his feet. So I'm going to start with the dorsalis pedis on the one side. That's 2+ and normal. On the other side, 2+ and normal. And you can put both your feet back up. And I'm going to do the posterior tibial. That's 2+ and normal. So those are all normal findings. Next, I'm going to do his Achilles and plantar reflex, because before I did his patellar reflex with his knees. So I'm going to have you lay down. Go ahead. Put his knees out, his feet out. So I'm going to do the Achilles reflex. So I'm going to lift up his foot and I'm going to hit back on the Achilles tendon. And I should see the toe point. Good. Good. So that was a normal reaction that he just had. And now I'm going to do the plantar reflex. So I'm going to scrape along the bottom of his foot and there should be a reaction. Good. Fanning of the toes. Good. So the toes were able to curl inward. So that's a normal finding. An abnormal finding would be if they curled outwards. That you would see in an infant or in somebody with a neurological disorder. So you could sit up now, Tom. Okay, next I'm gonna have my patient stand up and I'm going to be checking his back and spine. So I'm looking at his posture, he looks symmetric. Now I'm going to look at the normal curvature of his spine. The cervical spine is slightly concave, the thoracic is slightly convex, and his lumbar has a normal convexity to it. So now I'm gonna palpate from C7 vertebrae, feeling the vertebrae, if they're out of place, if they're bulging, if there's any issues. There's none, so this is a normal finding. Next, I'm going to palpate the paravertebral muscles on either side of the spinal cord. and I'm feeling on both sides all the way down, noting if there's any tenderness. Is there tenderness?
Nope.
And there's no swelling that I note, so this is a normal finding. Next, I'm going to check the spinal range of motion. So I'm going to have Tom bend forward to his knees or to his toes. This is called flexion. Next, I'm going to have him come back up towards me. That's extension. I'm going to have you bend backwards towards me. Good. Now straighten up your back. Now bend to the one side. Now back up. Now to the other side. Good. To the middle, now he is. Now your feet are going to be in place and you're going to rotate to both sides, and I'm checking for the rotational angle. All of it looks good, and we're going to sit back down. Next, we would normally do the neurological assessment here of the cranial nerves, but Professor said to exclude that from the video for the sake of time. Okay, next I'm gonna have my patient do rapid alternating movements. So you're gonna take your hands and go back and forth like this. I'm watching his hands for coordination and smoothness. You could stop now. He was able to do that without any issues, so that's a normal finding. Next, I'm going to have you take your right foot and drag it along your shin down to your heel. Good, now do that with the other one. I'm watching him and he's able to do that smoothly with coordination and no difficulty, so that's a normal finding. Next, I'm gonna have him put his one palm out for me and close your eyes, and you're going to tell me if the objects you feel are soft or dull or hard.
Dull.
Or sharp. Dull or sharp.
That was dull, and this is sharp.
Good. Now the other hand.
Sharp.
Good.
Dull.
Very good. He was able to discriminate between the two, so that's a normal finding. I'm going to keep his eyes closed, and he's going to stick his finger in this liquid and tell me if it's hot or cold.
Hot.
Good. Now do it with your other hand.
Hot.
Good. And now I'm going to have him decipher again.
Cold.
Good.
Cold.
Good. So he was able to decipher the temperature between being hot or cold, so that is a normal finding. So he's going to keep his eyes closed, and I'm going to take his hand. I'm going to move your fingers, and you need to tell me if you're going up or down.
Up. Down.
Good.
Down. Down.
Good. So he was able to tell the motion of his fingers and distinguish them correctly, so that is a normal finding. I'm going to have you turn your palm. I'm going to draw a letter in his palm, and he needs to tell me what that letter is.
T. M.
Good. So he was able to distinguish between the letters in both of his hands. Next, I'm going to do 2-point discrimination. So I'm going to take 2 bobby pins. You're going to close your eyes, and you're going to tell me when you don't feel the 2 pins anymore.
Done.
Good. Now the other hand.
Done.
Good. So he was able to tell me when he could no longer feel, and I was noting the minimal distance to where there is a separate discrimination between the 2 points. He was able to do that properly, and now we're going to stand up again. Okay, now I'm going to have my patient go around the side of the bed, and I'm going to observe him standing. He's standing warmly, so I want you to come this way, walk back to me. Now walk forward in a straight line, heel to heel. Very good. Now turn around towards me and walk towards me again. Heel to heel. I'm watching, I'm noticing his balance, and I'm noticing the coordination in his walking, in his gait, his speed, and his posture. All are normal and appropriate, so those are normal findings. Next, I'm gonna do the Romberg sign. So you're gonna stand with your feet close together and keep your eyes open, and I'm gonna watch him. There's no swaying, there's no movement, so that's normal. Now I'm going to have you close your eyes. He's still not swaying, there's no movement, so this is a normal finding. There's no loss of balance or swaying, so that's normal. Next, I'm gonna do the pronator drift. So open your eyes and stand with your arms extended and keep your hands straight. Now close your eyes. He's able to keep his arms straight, and there's no drift of any extremities. If there was a drift, that could mean that there's a sign of stroke or neurologic dysfunction, so you can put your arms down. So this concludes my neuro and musculoskeletal exam, and that's it.